This is the latest in our Open Data Saves live sessions. We've got people coming in, so we tend to give people kind of 2 or 3 minutes to join, and then Ellen and Fiona are going to chair, but we'll just give them that minute or so. If this is your first one at these, thanks for coming. It's a collaboration between, started off as an idea between Paul and I. So Paul Connor, who's on from Open Data Institute in Leeds, and myself, I'm the founder of Beautiful Information. And over the last few months, the Health Foundation sort of joined in on helping chair some of these and support them, which is really good. So we're kind of getting into a rhythm of running these semi-regularly. We got kind of tripped over by Easter and half terms and so on, but we're kind of back on track now. And there's a whole series of these that we've run. Everything has been published online. Everything's on our site, which I'll ask Paul just to put a link in the chat to, but you probably all know about that. So everything's recorded, everything's there. There's a whole set of resources, all of the slides, links through where appropriate to code and applications that people have built. And we've come up with a whole, just a vast array of topics. Kind of started off through COVID, and probably 2 kind of parallel streams to it. So one, a very technical set of experts talking about resolving technical issues for us, sharing data, postal geographies, the fact that local authorities don't look up to CCGs, and where we get data about care homes, which will start to become pertinent today. And then a kind of policy stream of kind of experts talking about ethnicity take up by vaccines, and domestic abuse, how we can link police data to health data and so on. So we've tried to twin some sort of data experts for you with some fantastic technical experts. The focus of today is social care. Just for the future, and we'll sort of remind you at the end, we are going to come back to this sector, specifically around care homes in our next one. So we'll kind of publicise that, and please do come along to that. But let's get started. So we've got 3 speakers, about 12 to 15 minutes each. Ellen's going to keep them to time. Paul and I are here. We can help with screen sharing, and any problems as you go, just shout out. But I'll hand over to Ellen and Fiona.
Thank you, Mark. So good morning, everyone. For those of you that don't know Fiona and I, we work for the Health Foundation, which is an independent charity committed to better health and care in the UK. And the Fiona and I's work kind of sits within the Data Analytics Directorate, which sets out a future where everyone's health and care benefits from analytics and data-driven tech. And the work that we do sort of ranges from supporting others to deliver better analytics, creating innovations in data analytics ourselves, and also building partnerships with others. And we're really pleased to be hosting this Open Data Saves live session. Their ambition to work kind of much more openly and transparently is hugely important to affecting change for the better. And I think we've been really pleased to be improving our ways of working through pursuing, an open analytics approach in the work that we both fund and also kind of undertake ourselves. And so this session today is focused on open data and digital innovation in home care and supported living. So our work in the social care sector was prompted last year by watching, the profound impact of the pandemic on the sector, and realizing that there's really urgent work to do to highlight the changes and challenges facing the sector, including, the lack of actionable insight, in particular, in domiciliary care as well. And we've just begun a programme of funding to fund exemplar projects that will demonstrate how strengthening social care analytics can improve the experience of those, giving and receiving care. And we're pleased to have one of those teams here today to speak about their plans. And I'll hand over to Fiona, who's going to tell you a little bit more about our speakers.
Ellen, I'll just very quickly introduce the speakers before handing over to them. So we've got a really exciting mix today of presentations on digital innovation, the impact of open data, and also an example of some real world analysis using social care data. So first we'll hear from Claire Sutton, who's a digital transformation lead at the National Care Forum. Claire's going to talk about barriers and enablers for open social care data, and she's going to showcase some of the work they've been doing with their digital innovation hubs. Then we'll have a joint presentation from Emma Back from the Equal Care Co-op, and Simon White. Sorry, I wrote you didn't nail them down wrong, Simon. I think it's Whitehouse, isn't it? Missed the second part. Apologies. From Open Data Services Co-op, they'll be telling us about their open tendering project that aims to show the impact of open tendering on the quality of social care services and the experience of people who are getting support. And finally, we'll hear from Chloe Pont, who's a data scientist at Birdie, who'll be talking about the analysis work they've been doing on medication risks in home care. If you've got any questions during the presentations, please just pop them in the chat. We'll have some time between talks to give speakers a chance to answer the questions. I hope we'll get Chloe back by the time it comes around to her presentation. We might have lost her in the meantime, fingers crossed. With that, I'll just hand over to Claire.
Hello, thank you very much. So my name is Claire, and as Fiona said, I'm one of the digital transformation leads at the National Care Forum. I've got 5 slides because I hate slides, so I'm going to share them, but just be prepared to be whelmed, I would say, probably, because I really, really hate slides. So I hope you can see that. And what I'm trying to represent here is that actually we're on a bit of a long and winding road here. So I don't want to say that any good has come of the pandemic, because that is not the case, but it's been very much accelerated the use of data and the use of digital technologies in care. So our members are all not-for-profit adult social care providers. And they have done some amazing things over the last 12 months and prior to that around adopting digital technologies, and are starting to really make that headway into using the data that they're producing. And I'm going to talk to you, it's a bit of a sense check really, because I don't want to come and say that it's all sunny skies and everything's brilliant and we're all using data amazingly, because actually we're not. And I don't want that to come across as really negative, because it isn't a really negative thing. We're just right at the beginning of this journey. And actually, as a sector, we need lots of support around us, and we need lots of people who are passionate about the use of open data and passionate about the use of that data for the betterment of people's health and social care. So the National Care Forum engaged in a project that started off as going to be actual physical site visits that people could go on to see the use of technology and the data that produced in action. And then a pandemic happened. So that didn't come to fruition. So we very quickly changed the tactic with this and produced webinars that were attended by over 300 people. Have actually been through the Hubble webinars. And the latest iteration of these is that we're producing videos that anybody can then go and look. And I've put the link on my last slide, and I'm sure that the slides will be sent out to you at the end. But part of that Hubble project was about looking at completely different settings across health and social care. So there was an organisation who ran a very traditional care home. There was an organisation that ran a new build care home where they'd really put the technology in right from the start. And there was an organisation that ran supported living accommodation for people. And they all use their technology differently, and they've all gone down slightly different routes to get to the choices of technology that they've used and what they're doing with their data. And there's been some prime examples in that as to how the data that's been produced has really driven how they have adapted the care that they're delivering. So Elizabeth Finn, who were one of the Hubble sites, they were a really traditional care home. They use electronic care planning, but they noticed quite early on in the pandemic that they were able to really capture data and use that data to really shape what they were doing in terms of caring for people that were potentially showing signs and symptoms of having COVID. And because of the fact that they had aptitude and competence and confidence in using their data, they were able to challenge their software supplier to say, we need you to produce a new care plan. We need a COVID care plan in place here. And I think that to me showed that they were really educated as to what they were doing. And that's not necessarily indicative of the sector as a whole. So they really are a shining exemplar of when you know what you're doing with your data, you can really use that to shape what you're going to do next. And I think we need to be honest. We need to say that actually, we are right at the start of this long and winding road. The destination, we can see it, but we've got a big journey to go through there. And quite simply, we can't just switch off traditional ways of communicating and traditional ways of recording data. There's still vast swathes of the adult social care sector that are just dipping their toes in the world of using digital solutions and collecting that data. And there are many that are, whilst they're using digital solutions, they're not confident with their data. So can we really be talking about open data in social care? Possibly not, because we're not yet at a stage where people have necessarily got that confidence, got that competence, and got that aptitude in using the data that they've got themselves. But I think we need to start sowing those seeds. We need to start showing people that actually, if that data becomes open, it becomes so much more useful, not just to them, but to all the other people that are involved in the care and support of the people that they're supporting. So just let me, I think, and I've said this a lot of times to a lot of people, data literacy, digital literacy, two different things, absolutely. And I'd be really keen to hear what people's thoughts are on that. But I think there's a lot of focus on building the digital literacy of the sector. And actually, you know, we talk about stereotypical care workers who maybe have no confidence in using technology, and that you know, I'm not digitally literate, I don't know how to use that. But the reality is that actually they've probably got a smartphone. They're probably FaceTiming their granddaughter or playing Candy Crush on their break. We need to get over this misnomer that actually the workforce as a whole isn't digitally literate. They are. They absolutely are. It's just a case of being able to transfer the skills that they use in everyday life to a sector that really needs that confidence boost. And I think that, again, the last year has really shown that so many people out there that would have previously absolutely said that they were just not literate at all in utilising technology, they've switched the way they live in their own lives to use things like internet shopping and, you know, click and collect and things like that. That's really come on in leaps and bounds. But what we need to start talking about now is that data literacy. So how do we go from being this sector that is adamant that our workforce isn't digitally literate to being a sector that can confidently say that we are data driven? And I think that's where that long and winding road comes in. We are halfway there. We're definitely getting there. And I think we should take real confidence from the fact that we've got these shining exemplars of where it's been done brilliantly. And we need to build on that, and we need to show the rest of the sector, the part of the sector that isn't yet confident, that actually it's not so hard and that they can get there. And if we start to embed the real sort of core values of open data into the sector, then that will help everybody. And it needn't be hard work for the care providers. I think a lot of this, sadly, has to fall on software suppliers. And it's an open market, you know, it's not a regulated closed marketplace. It is an open market, and there are many different providers in that sector, and some of them are fantastically innovative and really keen to use the principles of open data, and some of them, they're a bit secret squirrel, to be honest, and they you know, they want to hold their cards very close to their chest. And we need to try and break that cycle a little bit, really. So what can we do as a sector? Well, peer-to-peer learning, events like this, we need to ensure that social care attends these things and comes and talks to people and shares those experiences. We don't always have to turn up and say everything's brilliant. There's so much that can be learned by actually sharing what we know isn't going so great, where we know those gaps are, where we know that care providers are trapped with softwares that aren't enabling them to share that information, where they're stuck in a situation where they've got a giant Faraday cage of a care home. How can they go all of a sudden digital and mobile point of care recording when actually they can't get Wi-Fi out of the office because it's, you know, an old converted Victorian building and it's full of lead pipes, and it's just not that simple. And I think we need to share that knowledge, and that's where the learnings from the Hubble project are very positive, that people didn't just come along and pretend that everything was all rosy. People came along and really shared their experiences of how they've got to where they've got. We need to build a community around this. So there's lots of fantastic events like hackathons, there's community of practice and future care capital, there's the digital health forums, there's organisations like the Health Foundation that are really, really keen to incorporate social care into this. And as a sector, social care need to be part of this. We need to actually stop saying, we don't know what we're doing, we're not digitally literate, we're not data driven, we're not competent, we're not confident, we don't have that aptitude. We need to start coming out and saying, actually, do you know what? Yeah, let's embrace this. Let's throw some money into it. And that money, sadly, is probably going to have to come from government. I think that there needs to be a huge amount of investment from Department of Health and Social Care, which is starting to trickle through. And there are projects that are underway to try and encourage a more rapid uptake of solutions. And NHSX have got a very strong focus on ensuring that any solutions that are pushed into the sector are interoperable and will enable that data sharing. So I think what we really need to do is we need to be really proud, and we need to really shout loud about where we've achieved. But we also need to shout loud about where maybe we're not doing so great. Because if we shout loud about that, we can call for help, and we can say, actually, do you know what? Come and help us. There's so much that's gone on across the wider health sector that we can really learn from. And a lot of that is traps that we know we don't want to fall into. And there's lots of different projects that are out there. So I'm involved in a project with Birdie, and I know you're hearing from Chloe a little bit later, looking at utilising SNOMED CT clinical coding in social care data. So that's something that can make that data interoperable and useful to the rest of the sector. It can support the people that are using that data as a primary source to be able to use it in a more educated way and be more data driven, but it can also support other parties that are involved in the care and support of the individual to be able to do that in a much more educated way. You know, I'm a registered nurse. Everything we do is driven by evidence-based practice, and yet we don't seem to have embedded that quite right yet when it comes to data. I know that in terms of sort of digital nurses in adult social care, I don't get to speak to many others. I feel a little bit alone sometimes out there in the world. And that's why I am proud to shout loud about what we're doing, because I think actually there will be other people that are out there. We've recently run a survey with our members where we've asked them a lot of questions basically about where they're up to in terms of utilising technology. And I mean, it's not a wide enough sample size to be able to draw any conclusions about the entire sector. You know, we sent it out to our membership. We got 56 responses back, but we got 56 responses back from people that were keen to open an email headed NCF Digital Transformation Survey. So I'm not going to say that actually, do you know what, brilliant, we're all doing great. But it was really, really positive to see that of the respondents, 70% of them are using electronic care planning at the moment. 40% of them are using electronic medications management. 50% of them are using e-rostering. Down to sort of job roles within the sector. 45% of people who responded said that they employ somebody who's got a specific data analysis role within their organisation. So where are these people? We need to be building them into a community. And I think that we need to acknowledge that the existing communities that are in place are possibly not working for the sector. So the digital health forums have done amazing things for getting people to communicate across the health sector. But we don't have CCIOs, CNIOs, we don't have those roles within social care. We have people that are doing very similar things in a very, very positive way, but they're not necessarily seeing themselves as wearing those hats. So they lack that confidence to be able to say, well, actually, do you know what, I'm going to go onto that forum, I'm going to ask a question. So I think what we need to do is try and build that community around these people that clearly exist, that they clearly are doing these roles. And if we do that at an early enough stage, we can really shape where they go in terms of utilising open data. So I've put some resources on here. The first one, I would absolutely implore you to go and look at those Hubble resources. The learnings from that are far better than I could articulate in a short presentation. I didn't want to just come and repeat what's on there, because I think, you know, give over an hour of your life, pop on and off, have a little look at some of those findings that have been had. The Johnny Johnson housing presentations are absolutely fantastic. They are in supported living accommodation. We've got Parkhaven Trust who have built a new build care home where they've put circadian rhythm lighting, acoustic monitoring. It's really, really high tech. It's from the ground up, built with technology and digital and data in mind. And then Elizabeth Finn, who've got a traditional care home, but they've really become educated in what they're doing with their data, and they've used that to shape where they have gone over the last 12 months. Future Care Capital have got a community of practice, which I think is probably the closest thing we've got to having that place where we can go and we can have that peer-to-peer learning. So if you're not already a member of that, please join. It's only going to be as good as the people that are on there. I fully admit I get my weekly email saying, this is what's happened since you last logged on several months ago. So I'm as guilty as anybody else as not embracing the fact that actually we've got a lot of learning that we can all do from one another. Faculty of Clinical Informatics, if you're not a member, join. You don't have to be a clinical role to join as an associate member. Social Care has got, I think at the last count, we had about 8 members from within the social care sector. So we really want to try and, again, encourage that engagement. They are fantastically engaged and they're really, really keen to try and include more people from social care. You do not have to be a clinician to be an associate member. So anybody that is working within the sector, even if you don't have clinical registration, you can join as an associate member. Digital Social Care, which is a project that I'm heavily involved in. We've got so many resources on there to help care providers to make the right decisions, to make those steps on that long and winding road, be on that journey, and reach out, contact me. I'm always happy to bleat on about all things data and SNOMED and stuff like that. So do reach out to me. And I hope I've got a bit of time left for if there's any questions.
Thank you, Claire. We might be struggling for questions, but I wonder whether we could answer some questions in the chat, because a few things have come up, which would be great to continue that conversation.
Yeah, I'll hop over to the chat. I'll stop sharing my screen. So
wonderful. And would you as well be able to share some of the links that you shared in that last slide in the chat too?
Yeah, I'll copy and paste them all in for you.
Beautiful. And yeah, I love the shout for the community of practice. It's something that we've been developing alongside Future Care Capital. So we're really pleased that that it's getting a shout out, and that the rest of the fantastic work that you do has been so wonderfully described. So we'll pass over now to Emma and Simon, who are from Equal Care Co-op and Open Data Services Co-op.
Thank you, and hi everyone. Thank you, Claire, for that presentation. That was really interesting to hear, and hopefully I'll see you on the community of practice. I am going to share screen to tell you all about our projects with the Health Foundation. Okay. So the project is open tendering and open performance, which are not phrases that are commonly used at the moment. It's a joint project that we're doing with Open Data Services, who are also a cooperative. So I think one of the first kind of main points I want to make is that we are both co-ops, and the cooperative principles have accountability and openness written right into their DNA. So our governance requires us to be open. It requires us to be accountable, particularly to our members, but also with concern for community as well. The project is funded by the Health Foundation. Ellen has already said a little bit about the Social Care Analytics project, which is the first sort of dipping the toe in the water that the Health Foundation is doing into social care. And we're also working with our home council in the borough of Calderdale to run it over the course of the next 12 months. So why and what? The first questions I'm going to kind of jump into here. Open data is all very well, but it's very difficult to talk about open data in the highly competitive somewhat cutthroat environment of social care tendering and commissioning. The market is, I mean, it's horribly competitive. And providers are around 75% of all providers in particularly the home care market are for profit. And so those are the kinds of, it's very much bottom line motivations that you see in some of the ways, some of the practice and some of the ways of working that organisations have in this sector. Despite personal budgets growing in popularity, contracting itself still remains kind of the bulk of social care spending, particularly kind of looking at home care and community, so around to the tune of 18-19 billion a year. This little drawing just shows a typical tender process where the commissioners will write a massive stack of documents. So commissioning documents can usually run to up to anywhere between 50 to 250 pages. They're incredibly complex. They require a huge amount of work, often in a very tight time frame, and the tender kind of on the portal goes out and is kind of met by various people who have responsibilities for that in the provider organisations, and then they are the ones who obviously see and decide and write the bids. Now, the key thing here is that nobody sees the winning bid because of competition rules and because of that kind of that competitive environment. Often no one sees the specification either, even though that is supposed to be kind of open and available. It's often very difficult to get hold of current specifications for services that you might be receiving or providing as a care and support worker. And this is the outcome here. So we've got this situation where there are some really important stakeholder groups that people do a lot of talking about, but not a lot of working with, mostly because there are huge systemic barriers to preventing people from doing that. So around here, these are all the people who are sitting in the dark in terms of what's going on within that little black box of tendering and procurement for social care services. And here are the particular roles that you see in the council who will have access to it. Sometimes there is a service user representative, as they are often called, on the tendering and commissioning review board. Commissioning team, procurement officers obviously see the contents of various providers' bids. And then from the provider side, it's the service manager, who would be providing the proposed service that's being tendered for, business development team and senior management. Care workers who are responsible for delivering the service and delivering on the commitments that have been made by the provider don't see it. People getting support for that service don't see it. Other care and support providers who could actually learn some really useful stuff from the various commitments that are being made by other people in their work don't see it, nor does the social work team, who are responsible for engaging with the people that they are responsible for, who are getting support. They don't see it. Policymakers, central government bodies don't see it. There's a lot of people sitting in the dark here for what represents the majority of all data in social care. And if we don't start tackling this, if we don't start looking at it, and if we don't start challenging it, then we're only going to be messing away at the edges. Simon, would you like to say just a little bit about the kind of contract?
Yeah, I can pick up. So currently in the UK, Contracts Finder is the most comprehensive resource where local authority tenders are published. There is some standardization of this as data, and it is published using the Open Contracting Data Standard. I'll talk a bit more about that later. But Contracts Finder only publishes tenders and awards. So it's not possible to track the progress of a contract in a friendly way. I mean, you can download the council's monthly spending data and try to figure out what's been paid against the contract. That's a lot of effort for a very small glimpse of the whole picture that Emma's just been talking about. And I think the upshot of a lot of both what Emma's been talking about and the lack of transparency of the overall running of the contract from any kind of interoperable data standard point of view is that policymakers and commissioners repeat mistakes made elsewhere and start new initiatives that just replicate previous new initiatives without seeing any learning from those. And so that leads to a Groundhog Day of commissioning procurement in social care services.
So this is the kind of underlying principles of the project. This is what we believe, that the tendering commitments made across social care, across the sector, should be accountable to the people who give and receive those services. So that, notice, we're not just talking here about people receiving, we're also talking about the people who are responsible for doing that work with them. So the care and support workers themselves, who are frequently overlooked as well. That those services should be open and transparent to the local community. So that includes the tenders, the commitments made in the tender, and then that also includes the service performance overall. And then the idea is that that makes it much, much easier to make it, to be able to surface what works and what doesn't. And that's particularly people who, so the people who might be making those observations, it could be someone receiving the service saying, oh, this isn't working. For that to be seen by the by the commissioners, by other providers, by to be able to pick that up from a policy perspective. It's a little bit of an open data utopia that we're talking about here, but it's important to know what we're shooting for. So into the project itself, we're running over 12 months. We're basically using ourselves as the guinea pig for this, which is also a little bit scary because it's going to involve a live tender exercise with Calderdale Council that we are going to open up. It's also Equal Care Co-op's first tender exercise, so no pressure there at all. The method statements we will open, the tendering process we will open, and the initial kickoff to the project is these series of workshops in which the primary purpose of these is to understand what's important, to have a look at what's accessible, what would be an appropriate way of being able to hold us to account, and also to hold the commissioners at Calderdale Council to account. I think one thing I just particularly like to draw out here is something that we're calling a shared domain language, which I learned from the wonderful Giles, who is on this call today, which is about coming up with a series of words that work for people receiving support, people giving support, for middle management, for commissioners, and even for the data scientists, data engineers that are working as well. So when you use one word somewhere, then it's actually something that's reflected in the code and being used across all of those specialisms. And then there's apples with oranges.
There is apples and oranges. So that consists of 2 technical design sprints. So 2 chunks of work that will go on. These will integrate the project outcomes into the open contracting data standard. So I've mentioned open contracting data standard earlier. Open data services have been involved in all standards of its development and support, and we support it to this day. It's an international standard with publication across the world, and what it is a standard for publishing data on public contracting processes, public procurement processes. It covers all stages, so it can start from planning, goes through tendering, award, and contract, and importantly includes implementation. So during apples and oranges, we will build an extension to OCDS, so that the extension mechanism is one by which you can add new objects and fields that meet specific requirements. And so the specific requirements that come out of trust and culture building, we anticipate being able to build into the extension during apples and oranges. Obviously, this is an assumption, and there may be difficulties in and around that we will expect to hopefully overcome. So at the moment, we are also currently researching some of the data standards that already exist within health and social care, and where possible our extension is going to reflect those other data standards. Moving to implementation and review, the final stage, Open Data Standards will develop analysis of the pilot data set, and we'll do that in 2 formats. The first will be in a collaboratory notebook, and the second will be a relatively simple spreadsheet including pivot tables.
The fundamental kind of question here of did it work is, have we actually produced and are we now running a materially better service that has received an accelerated development, accelerated innovation, and has really been able to kind of improve rapidly rather than kind of looking at things on a 3 to 5 year tendering cycle as is currently the case. So here's kind of a couple of the key things here around looking back at that original massive stack of documents. One of the key features of the project is going to be making that massive stack of documents accessible, and then also to be able to capacity build people through kind of a series of community education workshops to actually be both feel the permission and the ownership to hold the service and council members to account. And here's all of the people who are now suddenly in the light and able to open up and see those documents and see that service performance. This isn't scary at all. Not scary at all. This is what success could look like. So oh yeah, sorry, Simon, you start this one.
Yeah, I do. Yeah, thanks. So what does success look like? For open data services, we aim to make open data useful, usable, and in use. And for Equal Care Co-op on this project, one of the main successes is being able to capture, publish and analyze data quickly in order to make improvements to the service in the way that Emma's just described. So flexibility is key. Publishing contract data online in OCDS, Open Contracting Data Standard format, produces structured and machine readable data that can be compared with other such data sets worldwide. It also gives the project access to a range of existing tools and services that already exist to support the publication and analysis of open contracting data. So these qualities of interoperability, comparability, and reuse of tooling by our co-op members who are already experienced in interpreting OCDS data, these all come together to give the project the flexibility that it needs.
And one of the features that I'm most curious about is the extent to which this could increase collaboration across groups that are usually not quite at odds, but are usually operating in completely different worlds to one another, and tend to only come together at the point of tendering. So people giving support, commissioners, service providers. Here are a few people that we're sharing this with. Hi ODI leads. Yeah, Simon's already mentioned kind of collaboratory notebooks. We'll be doing some storytelling as well, using a dedicated site hosted by Gitbook, and then kind of here are a couple of the sort of the key sort of social care movement and organisations that we'll be blogging with. You can see Future Care Capital there. We are also involved in a it hasn't updated, but anyway, social care innovation project run by LSE, which is a research project spanning 2 years, which the outputs of this will also feed into.
Thank you, Emma and Simon. I wonder whether we might have a couple of time, maybe like a minute or two for questions very quickly, if anyone has any thoughts before we pass on to Chloe at Birdie.
Stop sharing. Hang on.
Just to say, Emma, I really liked your slide on people sitting in the dark. Thought that got the point across very well.
That was Simon's idea, so credit where credit's due.
and your design work. I think the original looked a lot less professional. Sorry, Paul.
Yeah, it's Paul here from ODI Leeds. This fab, absolutely brilliant, and I can sense the hand of Giles somewhere in there with story blogs and technical blogs and repos. So yeah, lots of the similar patterns that we work with here at ODI Leeds in there. Just an offer really, if you would like to put some of your story blogs on the Open Data Saves Lives website or the ODI Leeds website, do some guest blogs there and link. I think that'd be really, we want to amplify your work, right? So putting it in more places on the web is the right thing to do. So please reach out and we'll help.
Thank you. We will.
Thank you. Just to make sure that we have enough time for the final presentation, I'll let's move over to the chat for more questions for Emma and Simon, and I'll now hand over to Chloe for the final presentation.
Thanks, Fiona. So I am going to share my screen as well. Okay, can you see that? Okay. I'm going to take that for a yes. Okay, so yeah. Thanks. Hi, so yeah, I'm Chloe and I work for Birdie. And today I'd like to talk a little bit about how we use the data that we collect in social care for different research projects, and specifically about how we used it recently in a project about identifying personalized risks linked to medication interactions. So first, interesting, okay. First, I'm just going to talk briefly about what Birdie is and what our goals are. And then I'll go into the project, the details of the projects to identify and prevent medication interactions. So first, Birdie, it's a digital care management solution for domiciliary care agencies. And as you can see, it's mostly a web interface for agencies and an app for care workers to log the details of their visits when they go into the homes of their clients. And so that means we collect data about service users, their needs, their medical history, the risks that they might have, and visit logs data every time a carer visits a user. And so, yeah, just as because this is a data talk after all, a few numbers. So we work with hundreds of home care agencies across the UK, and that means over 18,000 care recipients and over 200,000 visits every week. So that's quite a bit of data. And what we try to do with it is, first, of course, is to help agencies deliver better care. So our main goal is definitely to help our clients, but also on a bigger level, we'd like to try and use insights from agencies' data to help local communities and the health and social care industry in general. And so our mission is really to help older adults live longer and healthier in their own home, basically. And so to do that, we strongly believe that our main partners are agencies, because it's their data and we do that for them. But also on the more blue sky projects, research projects, we like to work with research partners because they have the expertise and the means to actually pull interesting information from this data. And so those research partners include universities, research organizations, other companies that have other types of data that could complement our data. And Claire mentioned earlier that where we started a project with her to start codifying some of the free text observations that come from daily visits using SNOMED. So that's an exciting one. But today I wanted to talk about a project that we worked on late last year about looking at how the data we collect about when people take medications could help prevent risks linked to medication interactions. So what we looked at is, so we know that over 1 in 10 people over the age of 65 take at least 8 different prescribed medications every week. So, and taking a lot of medications can make adverse events a lot more likely, like side effects, falls, decreased mobility, hospitalization. So this is a core problem for the care sector. And we looked at our data and we saw that in 2020, we collected 7 million free text observations in visit logs and 5 million records of when a medication was taken. So we thought there might be potential here to help detect interactions and help prevent them, hopefully. So what we did is we partnered with Faculty, which is an AI research company, and Oscar worked on a 6-week project to see if our data could, well, agencies' data that we collect, could help identify medication-related risks. So what he did for 6 weeks, his goal was really to determine whether we could identify risks of a specific medication causing an undesired side effect. So he looked at 2 main pieces of information from the visit logs and put them into timelines. So the first piece of information is when care recipients experienced adverse events, and that could be found in the text logs, and then when medications were taken. And he looked at that for thousands of care recipients. And that allowed him to run hundreds of hypothesis tests to look for statistical associations between those medications and adverse events that occur after they are taken. So it was a pretty powerful tool. Oh, I should say as well that we also controlled for the possible influence of medical conditions by using medical history records that we also collect. And yes, last thing also is that all the medication data that we have is encoded in SNOMED. So it really helped to have a clean, as clean as possible data set. So the result of this first rough model to see how this data could help is that we were able to get an initial picture of medication risks. So if you take, for example, Dorothy, who's an 86-year-old, and she receives care at home twice a day to help her with washing and dressing and taking care of her medication. And as you can see, she has a bit of a complicated medical history, which means she takes a wide range of medication for her conditions. And so with Oscar's model, we identified that 2 of her medication were associated with an increased risk of anxiety and depressive symptoms in people like Dorothy. And 3 of her medication are associated with an increased risk of fall. So I think building this kind of model is quite powerful, and that with this knowledge, care agencies could, for instance, ensure that her carers check on her mood regularly and encourage social interaction to make sure that potential depression side effects are accounted for, and they could also check that Dorothy's walking stick is within reach, and they could recommend a falls alert device to prevent the risk of fall. So it could become quite interesting to personalize care even more based on the medication that people take. And so, yeah, I think a tool like that could help agencies identify care recipients who are at a greater risk of a range of adverse events. And that means they could step in and try and prevent problems, and they could also access more personalized risk estimates. And so we were quite happy about those results, and we decided to apply for a grant, so the AI in Health and Care Award, to try and take that project further and build an actual machine learning model that would use the data that Birdie collects to identify and mitigate symptoms related to individual medications or combination of medications. So we hope we will get that grant to keep working on this problem. And yeah, I think this problem is kind of embodies our mission, because this model would help our agencies, because it would get integrated into the product and help them assess medication risk. But it could also, at a local level, help identify medication anomalies. And at a national-wide level, I think it could complement the perspective that we get from clinical data, because, well, first, the population is a bit different from clinical trials. And also because it contains day-to-day information about medication. So where clinical data is more, we know that this person is prescribed this medication. Social care data is, you know, this person took this pill at this time and we know what happened afterwards. So yeah, that's it for me.
Thank you, Chloe. That's really, really fascinating. I can already see that lots of questions are popping up in the chat. So clearly everyone agrees. I think there have been a few questions around your plans to publish both the model and the statistical results coming out of the model, and I guess the findings on drug risks. So I wonder whether you want to comment on that.
Yes, absolutely. So this initial model, I don't think we would publish anything yet, because it's not, you know, it was a first proof of concept model. But if we manage to work on this machine learning model to identify the proper model, then yes, we would definitely look at publishing something and sharing the results with anonymized data. So yeah, one thing we really tried to be careful about and really care about is only working with anonymized data and not leaking any information about our clients. So, but yeah, we would definitely look into doing that.
And one question I had, enough time, is whether you used any sort of prior clinical knowledge about the effects of certain drugs, or whether you just went into the data sort of completely naive without any hypotheses.
So that was actually one of our struggles during this project. We did try to access some data from the BNF, for instance, but it's not as easy as we thought it would be. So it is part of the grant proposal that we would access some clinical data and control for the data that we found with the clinical data, but we haven't yet.
Great, so I think we have a few minutes left, so I just open up the floor for any questions for any of the three speakers, or more general points, discussion, comments. Anyone wants to jump in?
Fiona, just a quick one on that last point. I would have thought, given what Chloe's doing, that you would get ethics approval to be allowed to link back to the patient. So maybe that's a second phase. Maybe this is kind of exploratory, but I would have thought with what you're trying to do, it would be reasonable for you to go back and actually link to a patient, because if you're seeing a risk which hasn't happened yet, people with these characteristics might have this outcome. It's perfectly reasonable to go back down through the data and re-ID them and contact them. but that's maybe the next phase. But it's really interesting, really interesting. I've put a note in the chat, Chloe, if we could hook up about Kent, that would be great.
Yeah, absolutely. I'll have a look at the chat
Thank
afterwards.
you.
But yeah, I think the plan is definitely, once we have a model that works, to then apply that to Birdie users and evaluate their risk and surface that to agencies.
Yeah, brilliant.
Well, thank you, everyone. I think it seems as if we're coming up to time, and I would just say that one thing that Open Data Saves Lives does fantastically is to kind of continue the conversation online and to, you know, host the slides and prompt debate across the system. So I would say if you found today, interesting and as sort of like useful as I have, then do check out everything else that they're doing. And if you have any questions about the work that we're doing, or anything else at all, really, you can get in touch. But I think, Fiona, unless there was anything else you wanted to add. Wonderful. I think I'll let you all go for your lunches. Hopefully the weather for you is here.
Can I just jump in? Can I just jump in for a second? Just to signpost the next 2 sessions. So Mark, do you just want to let people know what we're doing next? And then I've got some good news about the one that ODI Leeds are hosting in the one after next.
Yes, so I was going to say 6th of May. I think it's brilliant that we're looking at social care and care homes in more detail than people have historically. So 6th of May is digital care homes, which I will chair, and we'll send some more information about that. And we've got brilliant speakers already lined up. Paul, do you want to go next?
Yeah, I think, and the one after that is the 20th of May, and I'm really excited actually. We had some talks with Professor John Wright from Bradford. They're going to talk about the Connected Bradford scheme. So you may have heard of Born in Bradford, which is a cohort of 30,000 people which they've followed from birth all the way through. So it's a fantastic asset that they built in Bradford, and I think it's almost unique in Europe. And then that's linked now to Connecting Bradford, where they're linking data about people and place together. They're going to talk us through the not just the sort of the policy level stuff of Connecting Bradford, but we're going to get a technical discussion around what they've built, the technical aspects of that, how it works, how they've dealt with all of the information governance aspects and permissions. So we're still working with them, but you can imagine that it'll be 3 stages of this is what Connecting Bradford's all about. This is where it came from in terms of born in Bradford. Here's what we think we could do with it, but then also a run through of the technical aspects. And for all of us nerds on the call, yeah, how does it bloody work, and how have you managed to get that done? So I'm really looking forward to that.
Okay. Thanks, Paul. Thanks, everyone. A minute before noon. See you all soon. Hopefully on the 6th of May. Take care, everyone.